Thank you, Robin. I'm Ali, a researcher and host of ThinkCraft, an educational policy podcast. And I'm really excited to be talking to you today, Robin, Director of Nursing, Professor of Nursing. And I'll have you introduce yourself, what
Sure.
people ought to know about who you are, and then I'll kind of get into uh, the things that I'm curious about. I'm looking
Sure.
forward to talking.
My name is Robin Gates. I've been a nurse here for greater than 27 years. I work as a director of nursing for St. Anne's Intergenerational Care Center.
Right,
I am also a assistant professor of nursing at MSOE for greater than 6 years.
right.
Um, I've just enjoyed the nursing profession as a whole. I've done a variety of different job roles throughout my career. I've worked in home care and hospice. I've worked for Blood Center of Wisconsin. I've worked for organ and tissue transplant. I've worked in clinical
Oh,
trials,
right,
worked in the emergency room, worked in labor and delivery.
right.
So a variety of things over the almost 30 years. Yeah, coming
Yeah,
up on that. It's been a lot of different roles, and I've worked in also in communicating with healthcare plans with their members. So
I see.
doing telehealth um,
Right,
and working out of Minnesota doing that. So
right,
American Healthways, I think they're called Healthways now, but providing education to newly diagnosed members of an insurance plan.
I
And
see.
just like you just recently got diabetes,
Right,
do you understand what that is? Do you need the support with your medication? So they get a call from a nurse. And then the company we worked through was Blue Cross Blue Shield. And we
gotcha.
saved them money with their members by educating them and supporting what their next steps would be in ensuring they were receiving optimal care.
Right, right. And what is the so I'm very curious about the student to profession pipeline. What is your experience to, with like an emphasis on the schooling, how you got to whichever came first, the
Mm-hmm.
nurse or,
Mm-hmm.
what's your educational story background?
Well, I think it starts with inspiration. Usually, as a child, you see somebody, you see someone that you admire, or you learn about a particular industry, and you start. For me, it was in a church. I noticed a nurse in my church, and as a little girl, I was just attracted to her. She was caring, she was kind. She seemed to be living a good life, and it was how she made me feel as a little child that really attracted me to her. Um, and I thought to myself, I want to be like her,
Yeah.
not just as a child, not fully knowing what she did and everything. And then I found out later she was a nurse. I remember as a child going to a physician's house. Now I'm dating myself, but my grandmother used to go to a doctor's house who had his own practice, and the doctor there. We walked in the living room, and that was like the waiting area, and the nurse was there, and the doctor, and that was private practice for medical care that I was exposed to, and so it was just positive experiences. As I grew to understand after having private school experiences, homeschool experiences, um, I just determined I would love to be a nurse.
Wow.
And it was after I understood what it could be, it was a journey. And I never had anything written out about this is what I'm going to be. There was never any end stage. It was actually entering into the field. I went to the University of Michigan in Flint. And at the time that I was entered into the nursing program, I believe it was 32 students per semester.
Right.
And at that time, it was a big thing. You know, we went through the Black Lives Matter. At that time, it was saying that University of Michigan was very racist, and they weren't taking black people into different programs,
Yeah.
and I applied and got right in. I had some amazing referral sources that supported me, and got my bachelor's. And
Gotcha.
from there, as I rolled into different positions in my nursing career, that was when I decided, okay, I would like to continue. And so I thought, good to balance out nursing with business if I'm going to be in leadership roles.
Right.
So I did University of Phoenix for my business degree, and then University of Phoenix online for my master's in science of nursing. And that was because I was already in managerial positions.
I see.
And so I just wanted to keep going to school. So it was just, and so now I'm in the PhD program. So
Right.
it's just, everything's just about as you continue through your journey,
Right.
you realize education is extremely important.
Yeah, and it's like for would they call it continuing education
Yes.
credits or whatever?
Yes. Yeah.
Can you tell me like what a nurse should kind of expect as far as once they get their bachelor's, they pass the nursing exam. Is schooling mandatory then afterwards of like these continuing education credits or anything like that?
With nurses, a lot of our states require continuing CEUs, continuing education units are required. You have to realize a lot of the information we receive in medical field is already 5 years outdated by the time it comes into the academic environment and
Right.
the curriculums. And so we're already behind the eighth ball with just understanding the latest research. So we're trying to keep everyone abreast of that as fast as we can. And then you have the backlag of, you have it where once you enter into the industry,
Right.
how do you catch up? How do you change practice? How do you inform and educate those who are already working about the latest and the newest adjustments and evolutions that we have determined will provide optimal health? So then there's that education piece that continues in your actual daily operations.
Right. Right. And with the education component, we talked a little bit about this before we got it rolling, but there was a study that I came across where they were attributing these positive reviews to nurses to, I guess, personality attributes, things that aren't in a very definable way a part of the curriculum. And I was wondering, from an education perspective, like what makes a great nurse? And maybe two sides of the same coin with the question: how can education programs reduce burnout, or what could we do to like get the best and brightest and also not squeeze them of all their life while they're doing this role?
So when I think about what makes a great nurse, you would make a great nurse.
Yeah.
Absolutely. It's removing the stigma that's out there that nursing is just for females and that it's only a female industry. We need nurses that care about people. We need nurses that want to understand the science of how our bodies are made and how we can contribute to supporting those who are struggling, those who are vulnerable, those who just want to improve and live in the best of health. We want to partner with them. We don't want to, be authoritative about their health care. We want them to tell us what is it that helps you to feel the best about your health. We want them to be alerted to the things that cause danger that they may not be aware of. And so we're constantly looking for nurses that are caring, that are innovative, that are visionary, that love best practice and understand how to achieve best practice from the latest research and from institutions that have proven that they understand the competencies that we need so that we can be successful. So we are trying to encourage more um, inclusion in what makes a good nurse, no matter if you have a disability, no matter if you're older, no matter if your gender. We want nurses that want to come into the profession of all ages and no matter your, like I said, culture, background, because the more you represent the people, the better we are able to understand and to be able to do the things we need to do to bring about the outcomes that we should.
Right, right. And so the caring, the innovative, right?
Mm-hmm.
Um, I'm I'm wondering like how much of being a great nurse, and you can speak to this from being a great nurse or from managing great nurses,
Mm-hmm.
how much of it can be taught in a class, can be like
Mm-hmm.
curriculumized,
Yeah.
or and how much of it is just like, oh, there's something to Robin. She's soft spoken. She's
Mm-hmm.
welcoming.
Mm-hmm. Mm-hmm.
What are your thoughts on that? On the in class taught versus not class skill?
It's interesting. I think when it comes to caring, either you have it or you don't.
Mm.
I think it's very hard to teach someone to be caring. I've hired over 100 nurses. I always say that because I've lost count, but that's a milestone in my career.
Yeah.
Um, I I think the part that's most trainable is being able to teach you how to be more empathetic, how
Mm.
to how to think outside of yourself, to think of others. That's a little different. The caring aspect, are you that naturally mechanically trying to teach somebody to care is different to me.
Right.
That's been my experience. I've seen nurses, and if they didn't come into it with the right um, characteristics, I can always build upon characteristics. We all can evolve. We can all change. God knows we can. I have over the years. I'm not the same nurse I was when I first started practice. So we all have to leave space for everyone's growth. Um, Maybe I need to leave a little bit of space to say that someone can teach someone to care. Maybe there's another nurse that has that, but I genuinely have found that if you're a caring person and you, whatever your life values and the way you were raised, if you have that already, I can build upon that.
Right.
But it's
Yeah.
hard to have someone come in who is not a caring person, does not exhibit that at all in any aspect of their life,
Right.
and say, I'm going to teach you how to care.
Yeah.
And maybe the therapist can do that or somebody else, but I have not found that to be as um, successful in the nurses that I've come across where I've not found that trait.
Right, right. And why do nurses do what they do? Because it's not the I'm not sure how secure the job is financially, or if with people feeling like they're replaceable or not. I don't
Mm-hmm.
know much about the logistics of being a nurse, but what do you think when you're managing these nurses, and it's beautiful seeing students become the profession. What do you think is motivating them? What's the draw for nursing?
First of all, outside of it's a science, it's a beautiful industry to be a part of. There is so much that nurses can do. I will challenge anyone to find another industry where you can do 1,000 jobs and still be a nurse. There's very few industries where you come into that profession. And if you don't want to work in a hospital, if you don't want to work in a clinic, you can work remotely, you can work like it's in an insurance company, you can work in home care, you can work in a school, you can work for an employer. Nurses are everywhere. You can work in a school. I
Oh
can
yeah.
go on and on. Nurses are everywhere. It's an amazing field. It's the best decision I ever made. Um, Nurses are attracted to this field because of a lot of things. You know, you still hear that nursing is one of the most loved professions, and that nurses really aren't interested in the money. They're just interested in taking care of people and doing. I'm here to dispel that's a myth. We are about our money. We are about being paid for what we do. The burnout that you see with nurses is because there has been um, the wrong information. You can take something, you ever see someone take something nice about you and then when they write the narrative, they take it and it goes in the wrong direction?
Mm.
I feel that way about nurses. Just because we're loving, just because we're caring,
Yes.
doesn't mean we're not using our minds we don't diagnose, the doctor diagnoses, that we're using our minds and the science of what we learn through best practice to ensure that we're understanding what we see with a patient, with a client, with a resident, with our partners in healthcare. We collaborate with physicians, nurses, our partners in interdisciplinary meetings. And it is because of our knowledge, our skill set, and our caring that we deserve to get the pay
Right.
for the work that we do.
Right.
And so I am really big on, let me dispel this myth that nurses don't care about pay, because they keep, and even in our surveys, when nurses select, there's 1,000 things to select. Can you imagine you only get to select one?
Sure,
And one of
right.
those things is, do you care about your pay? And then the next one is, do you love people? I'm just being funny.
Right.
Like, and the next one is, do you, do you think patients should come before this? And then you say to yourself, so if I pick pay, then I look like I don't care about people. But they don't allow you to select more than one thing.
Right.
You can only select one. So the one thing, I care about people, love them. And then they say, see, nurses don't care about pay. Oh, they don't know. That's not what motivates nurses. That's so untrue. And that's
Right.
why the burnout, that's why the dropout. The research shows that the average nurse drops out 2 years into the profession. We lose many nurses because the workload, the shortage of nurses, the lack of pay for what we do. And I believe very strongly that this is why we don't have more men entering into nursing, because, while there are many women who are primarily caregivers of their families, taking care of their families, they still look at this as a profession just for women.
Yeah.
And they're okay. They're okay with their pay. Nurses make money because the average nurse has more than one job.
Oh my God. Talk about burnout. So the thing about with the empathy and the caring is it's conveniently not quantified in payroll, right? Like all that.
Yeah. I like the way you said that.
Yeah.
Conveniently.
Yeah. And I don't really understand with hospitals, like if they are like privatized or what, because I don't think of hospitals and think of the CEO the way I would think of a company. But is it are hospitals like companies in a way? Like,
yes, they are.
Okay.
Absolutely. I think that's the reason why early on I somehow or another I got the message that, wow, I need to be a little more business minded with my nursing. And that's the reason why I got an MBA, because I understood for the positions that I was being offered, being a manager, being a director through the years, I had to be in control of a budget. I needed to understand the FTEs, full-time equivalents, for how many nurses could I, hire. You can't sit around whining and complaining. I can't walk. I've directly reported to a CEO 3 or 4. I directly report to a CEO now. And so when I walk into his office, I am not walking in saying, oh, we need more nurses. I need you. I need to walk in talking about our value, what is needed, what it costs to recruit, what it costs to educate, to train once they arrive on site, wherever we work, and their value once they are there. And so if you can't articulate that very well to a CEO, if you're just going and saying, I need more money or we want more nurses, you're not going to get anywhere. So that's one level that it starts at, but at a higher level, congressionally,
Yeah.
we have nurses and doctors that are in Congress, and we need more lobbying. So one of the reasons why I am into leadership, education, and policy while I'm teaching, teachers are the same way. They're not getting paid enough money. We've known this for years, right?
Right.
Educators. So I want more lobbying that are addressing nurse burnout, that's addressing the quality that we provide to this industry.
Right.
I want to see nurse pay increased. I want to see nurse privileges increased. We have nurse practitioners who have different responsibilities in different states, different organizations allow different things, whether it's prescriptive rights or non-prescriptive rights. There's just a lot that we need to advocate more for.
Right.
So yeah.
Absolutely. I'm like really happy that we have you in these fields because yeah, nurses don't have a default union or maybe they
Oh,
do.
there's lots of unions.
Okay, can you speak on that?
Yeah,
Is
yeah.
it like normal for a nurse to enter a union or?
It's really interesting. I remember early on in my career, I was very intimidated by unions. I lived in Flint, so you're talking about
Flint, Michigan.
A General Motors town,
Yeah.
union town, right? The
Right.
Teamsters and everybody, and so it wasn't the culture there was to have unions. And I remember the struggle as a new nurse. I worked at Hurley Medical Center in Flint, Michigan. I also worked at McLaren Hospital in Flint, Michigan, both very stellar hospitals to this day. I remember the strikes going on and the unions and what the nurses were upset about. I remember how difficult it was for nurses to say, if I don't go to work, somebody could die. You had that, and then you had the other side where nurses were saying, if we don't take a stand. So I never was a part of a union, but I've always been supportive of union and what they are advocating and what they are standing for in regards to nurse equality and pay. So I'm not against unions. I think if nurses' voices are not heard as we're moving forward, we need to have somebody that is articulating very clearly what nurses need for the future.
Yeah, and it's skewing female. What is so you've hired male nurses?
I have.
Right.
I have.
Are men kind of feeling awkward as they're going into nursing? Like I guess why does it skew female? I don't know if that's a silly question.
It's funny. I think depending on how the industry start, our industry, we give credit to Florence Nightingale, but prior to Florence Nightingale being the mother of nursing, and that was during World War I, you had a societal with the war, right? Men were the only ones going to war, so women were the ones that were taken care of, and so women became the dominant force within the industry. And then as the World Health Organization and different organizations throughout time tried to changes took place in the evolution of nursing, then it was, men can be nurses, and we have history. And I keep in mind, there's so many men that we will never know about that supported nurses, the nursing industry, because we may not have had the social media we have today. No one was writing a book about it, but we've never had enough men. I've hired men, and they have been extremely amazing to our profession. Representation does matter. Representation makes a difference. There's men who join our industry who have been told, oh, if you join it, it's because you're gay. If you join it, you're not a man. If you join it, you're not going to get the respect because it's a female dominated industry. I will say we have acknowledged that no matter what, if you join any profession where there is an unequal distribute, uh, if you see the disparities between men and women, then you're going to have probably some prejudicial or oppressive things that you have to acknowledge and that you have to evaluate. So in academia, we need to think about how we can recruit more males
Right.
into being educators. In the field, we need to think about how that comes in and how nurses, how females and males relate to each other.
Right.
So we've gotten lots of research out there about the oppression of females that
Mhm.
are in top positions. Like
Right.
any field where there's one that dominates over the other, where we have to check ourselves and be self-aware of our bias and our prejudice. And we want to make it more inclusive that men be a part of the field and not be attacked. We have seen issues where maybe when men come into the industry, there's research that has shown that sometimes they move up faster into some
Really?
leadership roles because they're a man and
Right.
they surpass women. So the same struggles that we have with race, with gender,
Right.
with all the different things that we struggle with where one has the power over the other,
Right.
you have to still look at how you're going to integrate, collaborate, and make it an inclusive environment.
Absolutely, absolutely. So the in the nursing education like pipeline, how much of these like power dynamic stuff, how stuff things,
Yeah.
how much of that is in a nursing curriculum? Like do nurses enter the field knowing about their union options or having an idea of the different power dynamics at play?
So I think it depends on your university, what
Okay.
courses are offered, what topics come up within those courses where sometimes those things are talked about. Also, I think the experience of the faculty that are teaching the courses, they can bring in, because just like you're asking questions, students, I learned so much from them. They're asking questions. They're asking me, Professor Gates, what about this? What about that? So there are many nursing organizations like the American Nurses Association. There's so many more that
Right.
I couldn't even name all of them. But I am a member of the American Nurses Association, so that's easy for me to remember right off the top of my head.
Right.
But every specialty, whether you're in med surge, whether you're in emergency or pediatrics, or it's everywhere. They
Yeah.
all have an association. So that's a one way of you knowing what are the proposals those associations are bringing to the table. What are the things that they need that they're advocating for? So when you become a member, which I encourage all nurses, if you're not a part of an association, you're just kind of out of touch with what's going on. You're just kind of working in an industry where I just don't like seeing nurses, and I know it costs, don't get me wrong. That's another reason why we need more pay.
Yes.
We should be getting into these things for free, but
Right.
nothing is free. So we need to pay so that we can be a part of the organizations without it hurting our income.
Yes.
And so those organizations are pretty stiff at times.
Right.
But what they do for nurses is advocate for our needs. They bring things to Congress. They bring things to the government that needs to be discussed in regards to access to care, a remodeling of our healthcare industry,
Right.
and the nurse burnout, the shortage of nurses,
Yeah.
pay, the lack of resources, rural areas, clinics,
Yeah.
our ability. AI is a big one right now, that we need nurses and educators that will be able to code and collaborate with GE and which I'm very proud of at our university that I teach at. We're about to build a brand new, I believe it's an $85 million AI building and at MSOE, Milwaukee School
Yeah.
of Engineering, which has a wonderful nursing program. And by learning coding, the STEM programs, by learning about how robotics and electronic health record systems work. We need nurses to help build those clinical pathways. We need nurses that will work together with IT and with these organizations as they create these medical devices, the robotics. They
Mm,
need us.
right.
We got to tell them what they have to have. And so I hope that our curriculum will be built more around the demands for the future.
Absolutely, absolutely. And the pay seems to be so crucial. Um, I think during COVID there was kind of this like marketing or tagline
Mm,
to remind people that nurses are on the front lines and
yes.
they're um, and it seemed like a lot of people felt the disconnect between
Hmm.
a lot of nurses felt the disconnect between being told they're rock stars and superheroes and so important and how they were getting paid or
Hmm.
earlier you said like nurses likely will work more than one job.
Yeah.
Just blows my mind.
It's
Are
almost the norm. You
ah,
hardly meet a nurse that's just one job. And if it is one job, I will tell you, very seldom is it just a 40-hour job. Those are nurses that are working 60, 80 hours, picking up double shifts. That's just the norm for many nurses. Very few nurses are working a 40-hour shift.
right,
Um, they put in lots of time. It's just the demand. We've had lots of hospitals close. If you look every year, there's rural clinics closing, there are rural hospitals, and we're going to see even more. We're going to see nursing homes closing. That's putting more pressure on
right.
nurses.
On existing staff.
And I don't want to leave out the CNAs, the certified nurse assistants. I don't want to leave out the PCWs, the personal care workers.
Right.
There are so many people that contribute to the healthcare team, which is endless. Um, but I want to say that nurses are going to be under more stress. So, even more, I need to advocate strongly. I need to articulate clearly
Right.
what we need. We need the pay so that we don't burn out. You're losing excellent nurses. There are nurses retiring. We lost a lot of nurses that retired during the pandemic.
Right. Right.
We let's not discuss the nurses that died during the pandemic and doctors that
Wow.
died, thousands that died saving lives, putting themselves in danger. We have other challenges that are going to come up in the future in regards to um, more pandemics. We see measles right now
Oh,
is on the rise. Measles was eradicated
yeah.
for years. For years, we never had measles cases. You know, to have eradication means at least for a year you've never had that disease pop up.
Right.
We never heard of this. Now, measles is out of control. We don't even have accurate numbers on it because we're not having the public health data like we've had in the past, where we
Mm.
can see what the numbers are. We hear some news networks saying we're at this number, this number. To what point are we going to let this go? You know, um, you mentioned the COVID. COVID never went away. It's still here. It was here before we knew it was here when the pandemic came. It was here many years ago. It just never had exploded to a pandemic.
I see.
All right. So when it got to that level, so that's what we don't want to happen with measles, that
Yeah.
it gets out of control. And he said we have a habit of becoming very comfortable. Like we're comfortable with the flu. We know every year there's going to be 40 to 60,000 people that'll probably die of the flu.
Right.
We're
Wow.
getting that way about COVID. How many people are we comfortable with dying every year from COVID? And there's so many people who are still dealing with the after effects of COVID, whether their smell has been, or their taste buds,
Mm.
or just cognitively some issues that we are following, call it long haulers. You can hashtag COVID long haulers. And so there are people still suffering. So we need nurses
Yeah.
that we are not, and I don't put down maids, and I don't put down waitresses, because I love them and they have their place and their value. But I say that to say there is an education component to being a nurse
Yeah.
that makes a difference in the outcomes of people's health. And that's the kind of nurses we need for the
Yeah.
future.
Absolutely. And it's so obvious that nurses are a net benefit to everyone. You would think like the nursing exam materials would be free. The nursing exam, I don't know if they make you pay, but you are those something like if you're a nursing student, do you have to pay to take an exam or
We pay
retake
for
it?
everything. Nurses
That's
pay for
insane.
everything. We don't get nothing free.
That's
We don't
insane.
get anything free. We pay for everything. And there, back to what you said, we have to get out of this honeymoon phase of patting nurses on the back. I'm tired of nurses getting nothing. Their recognition is so little for what they do. There are many nurses that are fabulous nurses that I've met that are LPNs. There are fabulous nurses that are in retirement that need to come out
Mm,
because we need to give them the respect.
I see.
We need them to, they can teach our young people. They may
Right.
not be up to date on all the technology, but we've scared them into thinking that they don't have anything to offer.
Mhm.
Part of balancing out an industry is looking at what everyone's contribution can be to getting us to where we can be.
Yeah.
I really, I'm 61. I'm proud of my age, but my students know that on the exam, if they put that I'm 61, they're in trouble because they better put 27.
Right.
So that's a fun thing that I do with them because it's lifelong learning. I don't ever plan to stop being a nurse till I die.
Mm,
I will never not be a nurse. Even when if they say you retired, I'm going to be doing something. I'll be teaching a class. I'll be writing a book. I'll
right.
be educating or mentoring. Or we are not utilizing our retirees. They have so much to offer. Yeah, there's things that have changed. We've evolved in some of the things. If I tell you some of the things that I learned that we don't do anymore, and sometimes my students say, Professor Gates, we don't do that no more. I'm like, what? Tell me. There's things that they've added, like keep my street cred good because, we think we know it all because we've been nurses for a long time, but they're out there on the front lines. They're now in the hospitals and they're practicing and they're seeing things. They come back, oh, got this new machine, or there's something different now about how we do this, or we added another thing to medication administration. I'm like, what is it? Tell me. So I love all that stuff.
Right, right. And then thinking of you as the nursing educator, preparing the next generation.
Yeah.
Um, the students that you're teaching, do you feel it's a difference between when you were coming up and being taught how to be a nurse and how nursing students are now? Is it the same sort of trade and learning process? Like what does that pipeline look like?
It's totally different.
Okay.
It's not the same. I wish I could say, we all want to say now I'm old enough to say, I'm going to start sounding like the grandma, like back in my day. I don't want to put down the new generation. There is so much innovative energy. They think differently. The Gen Zers, they think differently about life, about culture, about what they want out of life. Culture plays a huge factor on how we think. That's why way back, women tended to be at home, men were out working.
Right.
And then when women became into the industry of nursing, then okay, they can do this. All of that has to go away. What I see with young people that I love is that roles don't matter, gender don't matter. It's about partnership. It's about how do we work together to build what we're building, our family, how to love people. How do I I don't want to work as hard as my grandfather, my grandmother. That's what I hear them saying.
Right.
They're not interested in I tell them I have 2 jobs in a paper route. So they're looking at me like, how can I be smarter than her?
Right.
And I'm just going to have a half a job. And so we tend to. I'm looking at them, the culture I come from, like, oh, y'all don't have the same work ethic, and boy, we work. No, actually, they're smart. How do I work smart? How do I be efficient? How can I still have family time? These young people want to travel. They want to go on vacations more often. They're not trying to stack PTO for 2 and 3 years, and they're not trying to live the burnout life.
Right.
So you've got to meet that. And if you don't make your industry more attractive, you're not going to fill it up. You're not going to backfill the shortage that we have. And I believe we can do that if we give the credit that nursing provides so that it is attractive. And then we can really meet the needs of people in all kinds of environments.
Absolutely, absolutely. And getting into like the closing part of the episode, I am curious what your research topic is as a student. There's so many things. Nursing, director of nursing, professor, business minded.
Yeah.
You teach population health, nutrition, different courses like that.
Uh-huh.
On top of all of that, you are also a student. It blows my mind. We need more.
It blows
Robin
my mind
Gates,
too, believe me.
Yeah. What is student Robin Gates's niche of research?
I am excited because I'm at Marquette University as a student, as you said, in the PhD program. And so I'm interested in leadership, education, and policy, leveraging the years of leadership that I've had. And then while I love teaching, whether it's in the classroom, whether it's in the community, at the hospitals, the preceptorships, I wanted to, some have asked me, why didn't you get a PhD in nursing? And I could have done that. I just think nurses can do everything. I think I can get a PhD I might go back and get a PhD in nursing. Yeah. I wanted to do it in academia because of the fact of I'm teaching. There's so much I'm learning. I work with a fabulous team of faculty. Right. My chair at my university has led us in helping us to understand what the American Association of Colleges of Nursing need us to do so that we can perform at the highest level. So I wanted to go in the direction of, I think it's that education piece, the recruiting of students into our field. And I could have done that with a PhD in nursing, but I wanted to understand the academic role better. I think there are courses that we need to include in our curriculum. I think that there are more things that we need to, especially with AI, as I mentioned earlier. I think there are collaborative partnerships that we need to continue building within our curriculum. And I wanted to make sure that we have policies in how we recruit for nursing in place into our universities. I think if we're not at the table to create those policies for everyone who would like to become a nurse, I think that's a piece that's missing, because you don't have that. You have a small percentage of nurses that become that get a PhD.
Right.
I mean, in society, period. But in nursing, with the shortage and there's just very few of us that get to that level. So it's just another arm of what we can do, and I'm excited to be a part of that.
Absolutely, absolutely. Well, thank you, Robin. If there's anything you'd like to plug, you can let me know, and we'll make sure to put it in the description. But yeah, I love it. How would you, if we get a quick round of grade it, we'll call it. What would be a good topic? Nurse talk, nurse TikTok. If you got to grade it, just impulse F to A. Are you aware of the whole nursing talk thing?
I love nurse TikTok. I love social media. Anyone who knows me knows I view social media. I'm not against it. I feel like if you're not on social media, you're just not at the table. There's no way in my career, my life, that I could keep up with all the amazing mentors I've had,
Right.
teachers, peers, students, if I'm not on social media. I can give somebody a quick heart thumbs up, hello. I can post a picture. I can put a message out. I can share an article. And yet I'm not on the phone with you for a half hour. I don't have that kind of time.
Right.
I can't talk to everybody. But when I see them, when they're sharing, when I'm sharing, I think you can use those platforms for education, for recruitment, for marketing,
Yeah.
for positivity, for supporting mental health, and making the profession a profession that people want to be a part of. I think nursing was the best decision I've ever made. I'm ecstatic about it. And while those who have left it because there were some probably very valid concerns, and I'm sad that they have. I hope they come back. I hope I've re-energized
Yeah.
and let them know that we need them, and I hope the industry will become at the top level that we need to be.
Absolutely. Absolutely. All right. Thank you, Robin. I appreciate it.
Thank you.
Cool. That was our episode with Robin Gates. Thank you for watching ThinkCraft. If you want to support this podcast or stay in the loop, you can subscribe to our Substack or our YouTube channel. We're going to have all of the social medias for myself and my guest in the description below. And I hope to talk to more professors and roll that out this summer. Thank you guys for watching and listening to ThinkCraft, and I will catch you guys next time.